Neurological. The CNS is the brain and spinal cord. The spinal cord goes down to L2. A back break below L2 might not have any spinal cord deficits. Problems will be more substantial the higher the break is on the spinal cord and column. Complications from the injury can be fatal, not just the injury itself. The cervical spine is C1 to C7. There are 7 cervical spines. The thoracic spine is T1 to T12. The lumbar is L1 to L5, and the sacral is S1 to S5 and is fused together as the body matures. The peripheral nervous system is everything else. All are interrelated to the CNS, so if it's off, no movement or feeling, but gross motor skills might be usable. Check the 6 P's: pain, paralysis, pulselessness, paresthesia, poikilothermia, and pallor. The analysis of the CSF should be clear. Cloudy is abnormal. Blood is abnormal. It could indicate a possible intracranial hemorrhage or hemorrhagic stroke. The lumbar puncture is contraindicated for a patient with ICP. If you see drainage from the ears or the nose, that kind of thing, and suspect cerebral spinal fluid, you can do a glucose check. Cerebral spinal fluid does have glucose. It also has protein. Other serum and saliva will not have glucose. Cerebral spinal fluid. The normal volume is 125 to 150 mils. The highest safe pressure is 15 millimeters of mercury. Glucose and protein should be present. Blood and particulates should not be present. The frontal lobe, you lose inhibitions if it's injured. It is your conscience, kind of like a mum voice. The temporal lobe is towards the temples, the parietal lobe is at the sides, the occipital lobe is at the back, and the brainstem is within the CNS. Encased in the skull cavity, you have the midbrain, pons, and the medulla oblongata. All of this is encased within the skull, so there is not much room for swelling within the skull. A brainstem herniation is when the stem comes out of the brain cavity and can't be pushed back up. The patient will be marked as brain dead at this point. The sympathetic nervous system is fight and flight. The parasympathetic nervous system is feeding and sexual function. Headaches. There are many types and many causes. The pain origination is what you look for in the patient. When, where, what makes it better or worse. Shoulder and neck muscles, muscle pain, stress exacerbates headaches. Meninges is the blood-brain barrier. It can be breached with injury and meningitis. Facial structure can break or impact it. Hypertension, increased stress, blood vessels constrict. It causes headache and epistaxis, which is a nosebleed. The patient can take a health journal to pinpoint aggravating factors. Cranial nerves can cause headaches. A thunderclap headache is a possible aneurysm. Primary headache, the cause is the head. Secondary headache, the cause is from somewhere else. The most common cause is stress. This is the primary. Migraines can be genetic or from trauma. Tension-type headaches from depression. Cluster headaches from allergens, tobacco, and alcohol. Secondary headaches. Identify and avoid the exacerbant to prevent the headache. Headaches can be debilitating. They will have problems with their ADLs. They can miss work and school. And it has a physiological and psychological impact. For the elderly, a headache could also indicate subdural hematoma. They require additional assessment to identify. Migraine phases. They are prodromal, aura, the headache, and then postdromal. In the prodromal stage, they have uncontrolled yawns and light sensitivity. Most people who have chronic migraines will recognize it's coming, and they can take medication to prevent this. Dehydration is a big cause. The aura stage is tunnel vision, and they may have a strange smell or taste. Not that you will smell the patient will be smelling strange things. The labs you can do, secondary related to, can help, but no test will determine if you have a migraine. You can do a CT or an MRI to see if there's a tumor or a hematoma. You can check hormones, because hypothyroidism can cause this. Treatment, address pain. They need adequate hydration because there's probably going to be emesis. They need a cool, dark room, quiet, with no visitors. Meds. They can take triptans, but that can cause birth defects. Check their level of consciousness and know the Glasgow Coma Scale. And as we know, you can be dead and still get number 3 on the Glasgow Coma Scale, and 15 is the best score you can get. Seizures. Keep the patient safe. Is their airway okay? Note the time that it starts and finishes. Never put anything in their mouth during a seizure. Unregulated brain impulses cause a chaotic pathway response, and it makes a seizure happen. A generalized seizure is tonic-clonic. The focal is staring. You may not recognize it, and it can have an unknown onset. A motor seizure, you will have spasms and epileptic tonic-clonic. Non-motor will be a behavior arrest. You should describe the seizure, and the healthcare provider will diagnose. Sleep depriving tests can bring on seizures. It can have genetic factors, immune issues, or can be idiosyncratic. If you have seizures, you must be seizure-free for 1 year at least, or you can't drive. The seizure stages are prodromal, early ictal, the aura, and apparently service dogs can detect this. Ictal is the part that you see. Postdromal is the end, and you'll be very exhausted. The labs you can do, you can test for an infection, lumbar puncture, MRI, CT, EEG. A sleep study prevents sleep and elicit a seizure. Every patient's seizure is different. With safety during a seizure, side lying, protect the head with a pillow. Don't restrain them. If they know that they're going to have a seizure, if they're known for that, you can pad their side rails of their bed. Do not suction them during a seizure, and never start an IV during a seizure. The medication they can take, the sun is so bright, is phenytoin, but that can cause urine pink, red, or brown. You can also get a rash, which is Stevens-Johnson syndrome, which can affect all mucosa inside and out. It eats flesh. You can also get that from ibuprofen, which is great. Carbazepine, it can be for partial seizures, but it can also cause bone marrow depression, and signs and symptoms of med tox is bleeding, bruising, and sore throat. TIA, transient ischemic stroke. It is a precursor to a stroke. Some people call it a mini stroke. It's caused by a stenosis or an occlusion of the carotid artery. It will resolve, but it can indicate that a stroke is imminent. It affects the arteries, so there's not enough O2 to the brain. The risks are, for getting a TIA, hypertension, cardiovascular disease, diabetes mellitus type 2, obesity, sedentary lifestyle, high cholesterol, smoking, excessive alcohol, and a low financial status. Most TIA risks can be modified. Maintain a blood pressure less than 130 on something to have a 42% lower risk of another stroke or a TIA. Be safe, or be fast. I can't read. Balance eyes, face, arms, and speech, and time. Labs. Do them ASAP. A CT, MRI, or a CTA to check if it's ischemic or hemorrhagic, and this will determine the path to take for the treatment. If there's blood in a lumbar puncture for the blood in the CSF, it can indicate a hemorrhagic stroke. 80% stenosed will be addressed surgically. And these are the 12 cranial nerves. Olfactory, for smelling, you can ask the patient to smell something. Optic, the Snellen test, the vision test, can you see? Oculomotor is eye motor, eye movement. Trochlea, down and inward eye movement. Trigeminal is the 3 is forehead, cheek, and jaw. You can ask them to choose something. Abducens, abduction eye movement, side to side. Facial, expressions, they can taste sweet and salty. Vestibulocochlear is balance and hearing. Glossopharyngeal is the tongue movement and swallow, and they can taste sour and bitter. The vagus is the swallow, speak, and cough. Accessory, shoulder shrug. And hypoglossal is, I didn't write it down, but I think it's below the tongue, swallowing. So to remember this, the mnemonic is O, to touch and feel very good velvet are heaven. And to determine if they are sensory, motor, or both, it is some say marry money, but my brother says big brains matter more. This was Neurological and notes taken from the lecture, and it is written and read for me, by me, so I can understand neurology. Thank you.